basically we have 5 parts to our agenda for this morning's webinar. And I'm going to provide the first part, the first agenda item, which is the overview of kind of our grant. And it'll be just a quick highlight. So in all ways, when we looked at applying for the grant and that we applied for, in every single facet of it, we realized it just nudged us and moved us faster to where we had already wanted to go. So this is really a true statement. It's just accelerating our momentum. We have always been working towards a more coordinated system. We recognize and try to support all of our mixed delivery system partners. And not only in care and education, if you think about it that way, but also if you think about Iowa system, one of our strongest partners is our health component. So really thinking collaboratively and comprehensively for all things that impact the life of that child prior to going to school. The 5 bullets below really were things that excited us in the opportunity to be a part of this grant. We knew we had anecdotal information, but we knew we wanted to figure out how to be more deliberate with serving underserved and vulnerable populations. We had been working with the state integrated data team had been working for, gosh, well over a year, probably at least 2 years, creating trust, creating letters of agreement and support with each other. And as you heard last Friday from Heather and Cass, amazing things, again, have been accelerated because of things we had in place to move towards a data-informed decision-making system. We already use evidence-based decision-making in many of our decisions and activities that we are moving forward as a system. This grant just is helping us move that forward. Professional development networks, we really hope as a long-term goal, maybe we didn't quite get there in this 1-year planning grant, but wait till you learn about some of the activities and data and information to strengthen our professional development networks. And the last item that has really helped nudge us forward is to strive to be more family-centered. Connecting with families in ways in which that they help they feel more empowered as an advocate for their child, that they have knowledge and access to high quality programs. So see how that plays out in this strategic plan. This is a great slide that I think Kelly pulled together, and it kind of highlights, the depiction highlights the overview and construct of the PDG grant. So again, you can start to see those similar themes that we just highlighted. But it's a great one-pager if you're trying to describe to somebody what is Iowa doing in the early childhood systems world. So if you look along the left, those are our areas of focus. And again, I want you to think about those themes that you're seeing there as we continue through the rest of this webinar, to think about how are we addressing those areas of focus within the strategic plan that we're gonna review. Then on the right-hand side of this depiction, you really have to start from the bottom up. And if you recognized Friday, we talked about the needs assessment, the comprehensive approach that we've been able to achieve in our needs assessment, and really looking at understanding and using that data to help inform us. Then on level 2, number 2, activity 2, is exactly what we're talking about today, the strategic plan. And looking and saying, here's what we know, and here's how we want to move forward. So not only is this a plan that's been a part of our PDG grant, but that grant helps us as a state say we're going to be more intentional with our efforts. Activities 3, 4, and 5, so the top half of this depiction really is where we're going to be moving. And we are so excited to continue to strengthen the work that we would have in partnering with families, in thinking about a stronger early care, health, and education workforce. What can we do to really support that workforce? And then ultimately looking at how do we provide overall higher quality environments where those young children and their families are participating in programming. Next slide. I'm also just going to talk at a high level reviewing our strategic planning process and our approach. This is a great slide to show kind of what we had planned. And we thought we had all the time in the world when we set this planning timeline up, and you know how that goes. But we planned this work back in April and said, oh, look at how this all fits together. But I have to tell you, it's been a whirlwind. And we recognize that we wished we could have even reached out to more stakeholders, but we're hoping that after today, folks will feel empowered to give us feedback on what we're sharing. And I hope you will feel that this is an awesome strategic plan that we go through, because we've used all of the input we've received so far through focus groups, through planning meetings, through surveys, through looking at previous plans and reports from other groups. So we're just super excited about all of the data and the input we have gathered to get us to this point. The learning sessions hosted in July, we just have to again say thank you to those folks who gave us 2 full days to provide input. Each time we brought people together, we grew in numbers. And I just have to share, we had a facilitator that helped us with the 2 July meetings and the August 1st stakeholder workday to work on the strategic plan. And our facilitator helped us immensely. We also had folks from Iowa State and from the PDG core team help structure and make sure we were deliberate in gathering all input that we could from folks that gave us their time and energy. We are almost finished with the strategic planning process that we outlined this spring. And as you can see today, we're doing the webinar on the strategic plan. And our goal is to have an actual strategic plan that we will review with the stakeholders through a webinar on September 5th. If you haven't seen that information, please go to our website or ask me and I'll send you the link to make sure you can join us on that day. And then the final step is with the ECI State Board on September 6th. This meeting as well, we are just working towards, it will be a webinar-based meeting. So we will have a two-prong adoption process where we work with our stakeholders and then ultimately have the state board help adopt it on September 6th. Next slide. This highlights the needs assessment process. So the in-depth webinar that was hosted on Friday where our friends from Iowa State presented, this really talks about, we had a multi-pronged approach to the needs assessment. Iowa has, for the first time, has integrated data that was reviewed and shared. We used information from a successful family survey. We had a child care center survey that was completed by a high percentage of child care providers. We have hosted focus groups both with families and with a broad range of early childhood providers across the state. And we also have been reviewing documents that are either previous program needs assessments, annual reports, data that was submitted to the federal government for programming. We have a list of those 20 assessments and documents that were reviewed on the ECI website. On the right-hand column, this is the one I think we want to really keep focusing on, and it's, again, keep thinking about that theme of how are we serving vulnerable populations? How and where are our children 0 to 5? How do families access the care that they want for their children? How do we overall increase the quality? And what can we do to support the workforce through professional development and other means? So that's really, again, helping us think through next steps, not only for the strategic plan, but then for implementation and change. Okay, so we had a current plan that was adopted and had 3 main goals. You're going to see in our current proposed plan, we moved from 3 goals to 5. And Kelly will highlight more detail and share how and why we got there. We are also following, because the grant is supporting us, the grant has supplied guidance for our needs assessment and our strategic plan. But everything we do, we have found, has not been contradictory, but supports efforts we had already been working on. The needs assessment integrates the administrative data along with all of the other avenues that we have been seeking input from folks. And finally, we hope to be as comprehensive as we can with all of the stakeholders that choose and have time to be a part of all of these webinars and processes to review and provide feedback. Our legislated results areas are highlighted in light blue at the bottom. And this is our foundation. Back in 1998, when the legislation created Iowa Community Empowerment, these were the 5 result areas that were legislated to strive towards. I always remember Representative Faggy and Representative Heaton saying, you know what, it doesn't matter who you are, you can't argue with these 5 result areas. And how do we strive to meet them? And 21 years later, we're still working on them and consider them our ultimate stones that we want to achieve. Next slide. This slide and the next slide really begin to talk about our strategic planning workday, which was on August 1st. And this, we just wanted to share that in our makeup and representation, we made sure we had parents, grandparents, we had ECI state board members, we had both private and nonprofit groups and organizations that were a part of the process. We included ECI area directors, individuals from Iowa State University. We had state agency partners that serve on Early Childhood Iowa all be a part of the process, as well as our PDG core team, which also includes folks from nonprofit agency, Iowa AEYC, and state agency partners. This is some pictures of some of the flip charts that were created from the August 1st day. And, you know, it's funny, I've gotten used to doing pictures on my phone because the first thing I wanted to do was put my fingers on that first slide and then enlarge it so you guys could see all the detail, and knowing that I couldn't do that in this presentation. But I want you to know and understand the brainstorming and sharing that was achieved and shared with us that day was just amazing. I just was in shock at all the really innovative ideas and ideas that built upon where people were today. So these two pictures just give you just a quick blush of here's some of the ideas that were gathered. Next slide really starts to show how the PDG team the very next day dedicated a whole other day to say, what did we hear? Where did we see goals? How do we capture all of the ideas they gave to us and then more synthesize it and sort it, if you will? And so we physically started cutting different ideas. So even though an idea might have occurred in a conversation under our goal, what was then goal 1, it might work best as we chunked things into another goal, which ultimately might be goal 2 or 3. And so I just want you to know we kept every single piece of notes, whether it was on a little note cards, colored note cards, or if it was on the flip chart itself, and cut it and provided a place for it as we moved forward and began assembling a ECI strategic plan. Next slide. Okay, so at some point during the day, somebody said during how do we build more public engagement? I don't know who was the person that created it, but basically we kept coming up back to we are ECI. So it isn't just about ECI funding or just about the ECI office, but ECI is our early childhood systems work, and we are all a part of it. If we care about young children, if we are working in programs that are promoting and supporting the early childhood system. So we are continuing this mantra with We Are ECI, and we're going to name the strategic plan We Are ECI. If you look at some of the boxes on this one, this gives you a more key considerations for our overall approach in this new plan. How can we be inclusive? You know, thinking about this early care, health, and education system, how can we make sure we're inclusive? How can we really address access? Be more intentional with our efforts to make sure items and we are making things accessible to all. You'll learn a little bit more about the third box. Not about me without me, approach to planning, making sure families are a part of the decisions that are being made, making sure parents and families and caregivers assist with the development of activities and strengthening the programs that they choose to have their children or them as families participate in. How can we be more strength-based? Make sure we're thinking about things and building upon them. As you heard on Friday, again, just where we are moving with being more data informed is phenomenal. Just so excited about that work. You know, not that we brag in Iowa, because we don't typically, but I want to brag because I feel like we're just doing such amazing things on getting data that can help inform us and presenting it in a way that is usable to all. How can we be more measurable? Part of this plan that we're still really needing to work on is making sure we are accountable and have measures that are reviewing activities and things that we're doing, but also that matter. Really just thinking about how we can do that in a way that makes sense to folks. And then recognizing we may have things that we don't agree with or that don't work out the way we want. So recognizing that this will be a living, breathing plan that we may have to change. We may have to tweak or modify as we continue to move forward in the next few years. And last, again, I use that word accountability. Making sure we are doing things we said we were doing and using the data to inform us and just improving all of our processes. The next slides will cover our proposed goals and strategies and highlights of our action steps. And I'm going to turn it over to Kelly.
Good morning, everybody. I'm Kelly Davidov. I work for the Iowa Department of Human Rights. I'm also spending a good bit of time working on the PDG grant with the folks in the ECI office. And one of my roles with ECI as well is to serve as co-chair for the steering committee. So I've been fortunate to be a part of this whole strategic planning process over the last few months, and it's been really exciting and energizing. And I am pleased to just walk you through kind of an overview of where we are at with the strategic plan to date. I'll preface this by just sharing that we still have work to do. And I'm excited for this opportunity to talk to you this morning, primarily because we'll get feedback from you, hopefully. And I'm so excited to hear your reactions, feedback, and learn more about what we can do to continue to improve the plan that we've carved out so far. So let's see if I can move my own slides here. There we go. The plan itself, for those of you that are familiar with the current strategic plan that we have, it's a good plan. We've got 3 goals. We have strategies and action items, and it's in a Word document that is not too exciting to look at, but still has interesting content. I just want to share the new plan that we're developing. The We Are ECI Plan will probably look and feel quite different from the plan that you're used to seeing. In fact, the draft is with a graphic designer as we speak, working to make it interesting and engaging and include visuals and lots of other mechanisms to make it a plan that everyone can hopefully enjoy going through. So just an overview of how the plan will be laid out. We should have a draft ready to share publicly in the next few weeks as we kind of get through the design process. But it will include a few major sections. The first part of the document will really walk through an introduction, provide an overview of our system, a history of all of our efforts, and it will include a letter of support. We'll then go into guiding principles for how we want to approach the implementation of the plan. What are the key things that we take with us as we do this work? It will talk about the strategic planning process, all of the wonderful activities and conversations that Chanel highlighted a little bit earlier in the presentation. And then it's going to dive quite deeply into 5 goals with 12 targeted strategies. And I'm going to walk through each goal in a second, but just know that it's quite an in-depth document that we're hoping to share. It will also include a detailed implementation plan that will identify sort of how we're thinking about carrying out the work of all of the goals and strategies, who's going to be involved, who are our key partners, who's going to have kind of ultimate responsibility for making sure that we do what we say we're going to do. What do we think about time frames? What other resources do we need to leverage in order to carry out that work? All of that has been drafted, but we're still refining a lot of it. And then it will also include progress indicators. How do we know we're making any progress in what we said we're going to do? How are we actually being accountable and measuring the progress that we want to see for ourselves? So this is a visual representation of the 5 goals that we came up with. Before I walk through each goal, I just want to sort of frame your thinking. If you look at this, it sort of looks like a pyramid, right? You have successive layers that sort of build on top of each other. And that is very much how we're thinking about all of the goals in the plan. So if you look at the bottom, that foundational layer is goal 1, promote a coordinated infrastructure to advance the early childhood system. We view that as a key first step. Same with number 2, build public will for investing in young children and their families. The 3rd layer is ensuring that young children and families receive the services that they need when they need them. Then we have transform the early childhood workforce through formal education, greater professionalism, increased competencies, and new approaches to implementing best practices. And improve the quality of early childhood services for young children and their families across early care and education, health, mental health, and nutrition, and family support services. So that's just a quick flyover of all of the goals. And if you hang with me, I'm going to dive into each one in depth. And just know we will have lots of time at the end of this discussion for kind of more interactive questions and feedback and a discussion as a group. So goal 1, promote a coordinated infrastructure to advance the early childhood system. If you were able to join our first webinar last week where we went through the needs assessment in depth, hopefully that provides a good framework for looking at all of the goals we're going to go through. But some of the key things that came out of our needs assessments and the conversations that we had with stakeholders was that we really needed to improve and provide supports for how folks understand early childhood Iowa. What is it? What do we do? What's our relationship to other systems or to other programs and to communities? How do all of these things fit together? We also heard quite a bit of feedback about leveraging public-private partnerships, and we need to do better at that. And we need some concrete processes to help us do those things. The needs assessment also highlighted areas where we could support improved data-based decision-making. That really came through loud and clear in several formats. So this goal is our best attempt to articulate how we're going to address some of those concerns that came out of the needs assessment. We have 3 strategies for this goal and several action steps that correspond to each strategy. It's a lot of information, right, in one goal. But if you kind of just walk through this with me, strategy 1.1 calls for us to expand collaboration and coordination among state and local programs and agencies serving young children and their families. The action steps we've identified around that have a lot to do with looking at opportunities and limits to collaboration. Where do we run into barriers to that? Are there things within policy or within code or administrative rules or other system barriers that get in the way of intentional collaboration and opportunities to work together better? So we're going to be looking at those things and trying to address them. We're going to be defining specific roles and responsibilities across the system. Who does what, and what are the different roles, and how are we all responsible to that broader message of we are ECI? It's more than just one state agency. It's more than just one program. It's really a collective approach. And then how do we create routine communication and training and supports to help folks understand all of these pieces? So a lot of this strategy looks at enhancing kind of how we are articulating our system and making sure that folks understand what it is we're trying to do and making sure that we understand what it is we're trying to do. Strategy 1.2 calls for us to develop and nurture effective public-private partnerships at both the state and local level. When we were thinking about action steps that could support this strategy, we really did want to take a strength-based lens to that and say, where are these partnerships effective? Where do we have examples of success that we can build off of? And can we learn things from those effective partnerships? Can we document and replicate what's working well and then expand that through targeted support across the system? How can we highlight and showcase effective partnerships and really recognize the efforts that are working well so that folks can continue to learn and develop their own partnerships? And again, we're calling for that not just at the local level, but also at the state level. How can we really infuse that across the whole system? Strategy 1.3, I think, really excites our folks at Iowa State as they're looking at the integrated data system that we've developed for early childhood. This strategy calls for an infusion of database discussions and decision-making processes throughout the entire early childhood system. When we looked at action steps around this strategy, one of the first things that came to mind, obviously, is enhancing the capacity of our IDS system. We had a great first run that was supported by this PDG grant. We have so many more things that we could be doing and could be learning from integrated data. So how do we support that and make sure that we are moving forward with progress around integrated data? Not just integrating data, but then also how do we support the use of that data across the system? Are there routine tools or reports we could provide to help drive data-informed decision-making, both at the state and the local level? How do we improve our data culture as a system overall? You know, data can be sometimes a tricky thing, and making sure that that is part of every conversation and every decision we're making is something we want to build through sort of an openness and acceptance of data and how we move forward as a system. How do we create accountability structures for ourselves that emphasize the use of data to make sure we're actually using data and tying that to our decision making? We want to improve our capacity to measure outcomes for children and families that we're serving across the system. And one of the things that we also included as an action step for this strategy is trying to think about how we can create a more flexible system that responds to the changing needs. And this was something that came out of one of the stakeholder conversations, I think even on August 1st, was just taking a look at our component group structure. How do we make sure we're flexible, and how do we make sure we're using data effectively throughout all of those conversations and have kind of more fluidity across those groups? So this is goal 1. We can come back to this during the discussion part and have questions. Please know that these action steps all include lots of descriptive language about what we're thinking and what came out of stakeholder discussions and where priorities landed. But we're also looking at this plan with an eye to leaving room for further discussion. So there will be plenty of space for stakeholders and for the component groups and for local communities to really flesh out further what these action steps mean and how we move them all forward. There's some, like I said, some description, but it's not overly prescriptive, if that makes some sense. So that's goal 1. I know that was a pretty fast review, but I'm going to move to the next goal, hopefully just to keep us moving and make sure we have plenty of time for conversation. So goal 2 centers on building public will for investing in young children and families. If you are familiar with our current strategic plan, you'll note that this is a repeat goal. This is the same goal statement that we had in our current strategic plan. And we really heard loud and clear from stakeholders that this is still a priority, that we need to be communicating the value of investing in a high quality system. And that if we aren't making that case, we can't effectively increase funding for our system and have that funded to the level that we would like it to be. We also heard quite a bit of input, both from families and from providers and from stakeholders that joined our conversations. I mean, essentially throughout the entire needs assessment process, that we need to have a better understanding of what quality means. How do we build a quality system for families? And we also heard loud and clear that we need family voice at the table. that this is a key missing component in how we've approached planning kind of throughout previous iterations of our strategic plan. So with all of that in mind, we developed 3 strategies to support this goal. The first strategy calls for us to communicate the value of the first 2,000 days as the most critical stage of the human life cycle. This might look familiar to folks familiar with the current plan as well, but we really took a look and thoughtfully came up with some action steps based on all of the feedback that we heard from folks around how to make that happen. How do we actually commit to using that as our unifying message? So again, it's, our action steps are around making sure that that is used as our unifying message and consistently used as such. We wanted to develop and implement a communication plan, and the draft that we have even talks about how we make that happen in a very intentional and supported way. And we wanted to be sure that we are coordinating our communication efforts across all areas of the system. We have amazing partners, both public and private, that have lots of initiatives and campaigns going on, and those are all wonderful things that are part of our overall approach to raising public will for investing in young children and families. But how do we make sure we're coordinating? How can we work together to share a common message across all of these efforts? Strategy 2.2 asks us to partner with families and communities to improve communication about what young children and families need and how the system responds. I want to draw particular attention to this strategy just to share that this is more than just giving information out. This is about how we have two-way communication with families. We don't just need to educate, we need to listen. So this strategy calls for us to think about creating an information hub for families that streamlines and improves access to all of the different websites and other forms of information that we put out there about what services and programs are available within our system. How do we streamline that, make it more family friendly, and make it accessible? And then how do we partner with specific, community-specific thought leaders to improve bidirectional communication? How do we engage communities and families that we haven't ever engaged before? And I think where we're envisioning this being a key action step is to approach it as partners rather than coming in and directing how communication happens. So if we partner with local communities to do that, we'll have a better chance of success. Strategy 2.3 is asking us to look at and engage families as leaders and advocates for a comprehensive early childhood system. How do we authentically engage families in system co-creation? It's not just up to a bunch of professionals sitting around a table. It's really something we need to approach as partners with families. We heard that loud and clear throughout all of the input that we gathered from families and gathered from providers and even conversations we had as stakeholders together. We have action steps related to creating a family academy to support families in engaging with our system. And if you think about this, if you're a professional sitting on this webinar and trying to wrap your head around how the system works together and how we function as a really complex system of systems, it's overwhelming sometimes for us. And so how do we think about creating support for families to do that in a way that allows them to participate and help drive system change? How do we make sure that we're building routine mechanisms to gather family input, not just a focus group or a survey here and there, but ongoing opportunities for families to provide feedback on what we're doing? And how do we raise the visibility of parents and caregivers at system events and actually highlight families when they join and participate? Okay, again, that was a lot of information to digest about goal number 2. Happy to come back to this for further discussion at the end of the webinar, but again, just know that we have lots more detail in the draft phase of the plan, but this highlights the action steps that came out of all of the discussions we've had and the input we've gathered to date. So goal number 3, transform the early childhood workforce through formal education, greater professionalism, increased competencies, and new approaches to implementing best practices. I will share, looking at this goal, we have 2 strategies, but look at how many action steps we have under each of those strategies. This is a huge goal. There is a lot included, and it is all based off of feedback that we have heard through the focus groups, with providers, with surveys of providers, with stakeholders across the board coming together to provide their best thinking on how we can actually accomplish this goal. A few of the things that we learned about through the needs assessment process that I just want to highlight too to help frame your thinking about this goal. We heard loud and clear that some of the biggest challenges we face around workforce have to do with both the quality and the quantity of the workforce. That both of these things combined really impact our ability to provide services to families that need them. We also learned quite a bit about, looking at how we've tried to address this goal in the past, and thinking about how we've been relying on sort of that formal education piece to improve the workforce, and relying on college credit, and how that might not meet the needs of everyone in our workforce. And looking at the education levels of everyone that's currently part of the workforce, we need to be rethinking that, and addressing other mechanisms to meet the workforce kind of where they're at. We also heard quite a bit about the need to develop career pathways with progressive supports, and to actually pay for the quality that we're seeking. So those are the things that kind of grew out of the needs assessment. And then when we sat down and kind of back to Chanel's earlier slide where we were cutting and taping and pasting and reorganizing all of the great brainstorming that came out of some of the stakeholder work days, we landed on 2 significant strategies. The first calls for us to create a larger and more skilled early childhood workforce. We have 6 action steps under this one strategy. There's quite a bit of work to tackle with this one. We are calling for an effort to establish the field as a viable post-secondary career option, and actually reaching out to high school students to begin that process earlier than we have been in the past. We want to identify and recruit untapped labor. Where can we think about growing a labor force where we haven't thought about that before? We want to establish training for the workforce at all levels. Again, kind of meeting folks where they're at and not relying quite as heavily on that formal education piece around college credits. Although we do want to improve access to formal education and coursework that results in college credit. That's another piece of it. We want to engage the early care and family support professions, both in furthering their degree attainment, so continuing to make progress where they can. And we also want to develop a professional development hub. We've used that word twice now in our strategic plan. But the idea behind this professional development hub would be to streamline and make more accessible all of the training and supports and resources that we have available to the workforce. We have things kind of in pockets throughout. So how do we streamline that, put additional resources and support behind that, and make it a really effective tool for the workforce? Strategy 3.2, so the second strategy for this goal, calls for us to provide new or expanded early childhood workforce supports that enhance the quality of early childhood programs and services. There are 5 action steps that we've crafted to support this strategy based on your feedback and your input so far. And they cover a number of different things. They ask us to enhance workforce competencies, to provide ongoing support for competency development, to expand opportunities, to provide dedicated support and specialization for children's mental health and for children with special needs. This was something that came out loud and clear through the needs assessment process, that were pretty significant gaps in how we're meeting the needs of these families. And so how do we think about addressing that through our workforce and through the competencies that we have? And then probably the biggest and one of the most difficult action steps that we have is to address poor compensation and benefits for the early childhood field. And we probably need to keep working at this on an ongoing basis as a system. We have an action step to call attention to that, to provide commitment to that, but it won't be an easy action step to accomplish by any means. And I should probably say that about the entire goal. There is quite a bit of work that we've identified for ourselves in this goal. And even though this is a 3-year plan, many of these strategies and many of these action steps will likely take quite some time to really carry out fully. But we're excited to begin work on that. All right, goal 4 asks us to ensure that young children and families receive the services they need when they need them. This goal really speaks to access. How are families and children able to access services? Are they able to access the services they need? And how do we do a better job of that? The needs assessment process shed quite a bit of light on this particular topic in a number of ways. First, we learned through integrated data that we have some disparities in access, especially around our preschool programs. So how do we think about that? How do we look at that across all of our programs and say who's accessing and who's not? And how do we make sure that that is more equitable? We also learned a lot from families directly about barriers to access. They talked a lot about costs and about hours of availability and how does that work for working families? And when that's the predominant, and that's what parents in Iowa look like, right? We're working families. How do we make sure that this is available and accessible? We learned a lot, as I said, about gaps in services for children with disabilities and with mental health needs. That came out pretty loud and clear from families themselves. And we also learned a lot from families about how transitions occur within our system, not just from preschool to kindergarten, but also just among the services that are available throughout the early childhood system. If you need more than one program, how do you kind of cobble that together? And what does that mean when services are isolated? So we put a lot of thought into this goal, and we had some great brainstorming with stakeholders throughout the process. And we have 3 strategies to share with you, and each strategy has a few supporting action steps. So walking through these, the first strategy asks us to improve equitable access to early learning opportunities and services for vulnerable and underserved children and families. We have a couple of preliminary action steps around this strategy. The first calls for us to adopt a not about me, without me approach to planning. How do we authentically engage those vulnerable and underserved communities and children and families in helping to address these barriers and these needs? They know better than we do. They are experts in their lives, and how can we engage them authentically to plan out how we're going to address this? Then, how do we prioritize the most vulnerable and underserved children and families? How do we make sure we're actually addressing equity issues across our system and ensuring that access is more equitable going forward? And then we also have an action step around increasing access specifically to care by expanding participation in the CCA program. So we have a few action steps in there. And again, I look at this as an ongoing living document. And we may identify further action steps the further we get into the implementation of this plan. Strategy 4.2 asks us to expand and improve access to high quality early learning opportunities and services for young children and families. We have 3 action steps to address this, and they all speak to the barriers that we heard directly from families. We would like to think about how we cluster services to limit family travel needs. How do we think about expanding the overall number of slots available to young children? And how do we think about expanding the hours of programming, care, and wraparound services available to support children and families? Strategy 4.3 zeroes in or focuses in on the need to improve how families and children transition among and between programs and systems. Again, this sort of grew out of the needs assessments, also something that the federal guidance asked us to look at. But how do we promote stronger collaboration between school districts and local programs and services? How do we improve transitions between both the early childhood system and school districts? And then how do we improve transitions even among early childhood programs and services? One of the action steps that kind of grew out of this conversation too with stakeholders was the idea of developing navigation supports for families to really take the burden of trying to figure out how to cobble programs and services together and make those transitions work off of families and put them back on the system as a whole. So another goal that has a lot of strategies and action steps to support that. There's a lot of further thinking that we can do as a system around this. And again, just sort of being open to that not about me, without me approach to planning. This is something where there's plenty of space for feedback and for participation as we go. Okay, goal 5 talks about improving the quality of early childhood services for young children and their families across early care and education, health, mental health and nutrition, and family support services. So we are looking at quality across the entire early childhood system. And I'll just share, when we, as a team, when we were trying to organize and sort and think about how to structure the goals based off of all of the feedback and input, this was probably the most challenging goal for us to assemble, if you will, because all of the other goals speak directly to quality on some level as well. We can't get to quality if we don't have access, and we can't get to quality and access if we don't have a workforce, and we need an infrastructure to support all of those things. So it was challenging to think about this goal and specific strategies and action steps that didn't have something to do with all of the other goals as well. So just keep that in mind as you're looking through this. But it is probably, you know, this is our end goal, right? This is the most important thing that we're working towards, is high quality early childhood services for young children and families. And yet we need to work on all the other goals to even have a shot at this one. So strategy 5.1 asks us to promote and incentivize the use of evidence-based programs and services across the early childhood system. We have some things going on in this space within our system already. So how do we support continued implementation of incentive structures? Again, we have that already with the QRS system, but can we expand that and replicate that? Can we apply that to other areas of our system? Can we expand and replicate credentialing models? Develop a continuous quality improvement process to ensure that we have foundational quality standards met across all of our early childhood core services? And then how do we leverage statewide training and technical assistance to provide support for implementation fidelity? Strategy 5.2 is an interesting one. This is a little bit new for this overall strategic plan, and is not something we've addressed in our previous plan or our current plan. But it asks for us to adopt a collective impact approach to investing in high quality evidence-based services, programs, and activities across the system. The action steps that we have identified to support this strategy begin with conducting a fiscal scan, taking a look at where our current assessment or our current investments are. Do we have gaps in investment? Do we have opportunities to streamline funding or policies as well? And can we adopt a collective impact approach to aligning those funding and resources so that we can achieve targeted improved outcomes across the system? And then we also put in a call here for ourselves to reconstitute the resources and funding component group. That's an area that we haven't had a real active participant group to carry out this work, but I think we need to commit to that as a system if we want to carry out these other activities that have been identified. So I do want to make sure that we have time, it's about 10 o'clock, to open it up for questions and for feedback. Again, we went through these goals fairly quickly. There are a lot of strategies and a lot of action steps, and you probably have lots of questions about how all of this is going to work, how we're going to carry it all out. Oh my gosh, that's a lot, and it is. And I think that's maybe my favorite part of the name of our strategic plan, speaking to the We Are ECI, because it is going to take all of us to carry out the work that we've put into this plan. Your ideas and your feedback and all of the brainstorming that we've generated over the summer, we've tried to capture as much of it as possible in one plan. And it's an ambitious plan. There is a lot to do, and we need everyone at the table and ready to roll up their sleeves and get to work on it. And again, I'll just preface too that the plan is in design, so we don't have a draft to share with you just yet. That will be coming very soon. And you will be able to read in detail what these action steps entail, and really get into the meat of how we've described things based on your input and your feedback. I will pause, and I'm going to turn it over to my friend at Iowa State to help moderate some of the questions. Heather Rouse, Dr. Heather Rouse, who you may have heard at the first webinar, is here today, and I think between Chanel and Heather and I, we can field questions you have about the strategic plan and about the goals, and Heather might jump in with support if there are questions specifically about the needs assessment process as well.
Great. Well, great job, Kelly and Chanel. I think you did a wonderful job trying to represent the amount of collaboration that's really gone into the strategic plan. You know, it's been really fun to be a part of that. And I think just even seeing the call out, We Are ECI on a piece of paper is really, I mean, I kind of just got goosebumps. It's just really been fun to see how folks have engaged. And I think this is just another opportunity. I'm starting to see questions popping up. I'm going to start moderating some of those, but I just wanted to give a little bit of a shout out to, I think, what you've pulled together here in the short amount of time to really represent all of the hard work. I mean, you did a great job, but it definitely, we know it doesn't do justice to the amount of brain power and person power that's gone into thinking about this. And so just sort of a thank you to everyone on the call, not on the call, that's been in the room, that's even just been thinking about all this. Has been really cool. So we do have a specific question from Cindy. Help me understand the goal for not me without me statement, she says. And with the parentheses, great job. Very much something we can work on locally and support. So do you want to talk a little bit about the not me without me statement?
I'll take a first stab, and Chanel, feel free to jump in. I think, and I don't remember even where that phrase was coined. I think we had it on one of our giant flip chart papers that came out of the August 1st workday and planning session. I know it has been a topic of conversation in a few of the component groups, thinking about how we apply that lens to decision making. As much as we want to be data informed, we also want to be in partnership when we make decisions about the services that are provided, to whom and where and when and how. And I think historically, as an early childhood system, but even just across all systems, we tend to make decisions in silos, and we tend to make them as professionals, and thinking that we perhaps know best what families need and what communities need. And when we think about an equity lens, especially vulnerable communities, communities that have been historically underrepresented in decision making and in systems, I think this grew out of a recognition that we haven't made progress in those areas the way that we would like. And perhaps a different way to approach trying to make progress and achieve better outcomes as a system for those communities is to step back and let them participate and help direct decision making and say what's going to work and what's not, and how we need to provide better services. We haven't been successful ourselves, and so it's time to step back and create space for families and for communities, and particularly those that are underrepresented and underserved, to step forward and lead us instead of us trying to lead everyone else. That's my best attempt at summarizing that. Chanel, I don't know if you have other thoughts, or even Heather, if you were, part of those conversations. I know that came out of the August 1st, but it's also something I heard throughout the family engagement work group conversations, the equity work group conversations. So I'll leave it at that and see if others have more to add.
This is Chanel. I have nothing else to add unless Cindy, does that help clarify? It's interesting. I had a text from another ECI director that said, love, love, love this. And I want to steal it and put it into some of our local planning. And I'm like, great. So we'll see if we can find the source. And if so, we'll give that person or group or whoever the credit. But I agree, it helps. It just presents a really positive connotation on this is just a different way of doing business. Are there other questions or reactions, thoughts from folks that you want to share?
While folks are thinking, I did want to remind everyone, and this came up in the group chat as well, we are recording this webinar. We also recorded the needs assessment webinar. Both of those will be posted soon to the ECI website. They are not there yet, but they will be posted, so stay tuned. And for those of you that may have missed the needs assessment, that will be there as well. We're getting lots of excitement coming into the chat, folks, just resonating. I can't even describe how excited I am about the new plan, and I'm very excited and re-energized and a bit overwhelmed. Scared. Hence the name We Are ECI. I think that, coming back to your mantra, Kelly, I think that's going to be something that we will all hopefully help us feel better about putting our collective arms around our approaches and really just digging into it together. So
I will, if I can add one more thing too, as folks are thinking about, any questions you might have. Yes, this is an ambitious plan, and there are a lot of things in here that are going to require some committed support and resources in order to carry out effectively. With that said, we are also, looking forward to applying for renewal funding through PDG. And so, we wanted to have a balance. We wanted this plan still to be something we could tackle, even if we don't achieve renewal funding, if we're not awarded renewal funding. But if there are opportunities to seek renewal funding to support some of the strategies and the action steps in here, that is something, we'll continue to get feedback on. But perhaps that helps with some of the feelings of, oh my gosh, how are we going to do all of this? We'd like to think that perhaps there's an opportunity to get some support and resources to do a lot of the things that have been identified.
That's great. We have a couple other questions pop in. Oh, sorry, go ahead, Chanel.
No, I was just going to say, Christy Fenwick, I see your questions and comments. I just want to chime in. Regarding vulnerable populations, that is a definition we had to define in our grant. I don't know if I have that right off the top of my head. Heather, you might, that because you've lived that and breathed that. But we do have that available. But before I turn it over to you, Heather, I just want to share your second comment or address it, Christy. It's a very good point about eligibility criteria with regards to the family support program you cover. So that's still an issue of, are we missing families, or can we get them into a program when they have that need and or want? So that's just definitely some criteria we want to keep addressing and figuring out how do we strengthen the system. At this point, I don't want you to think that we're changing your eligibility criteria or anything like that. But just as we become more informed of who are vulnerable populations and what are they experiencing, then hopefully we as a system, whether that be at a program level, a local level, a regional level, at a state level, really start to think through how can we help.
Mm-hmm. Yes. So yes, to go back to your question about, and I think you specifically called out goal 4, one of the things we said in goal 4 was how we're going to pay attention to vulnerable children, and you asked how we determine that. So I'm going to answer that 2 ways. When we started our needs assessment process, we started with some definitions that our programs use to determine eligibility for things. So when we look at children who maybe historically have challenges facing them before they get into school, our children from low-income families, our children from minority families, that's where we started. Throughout our needs assessment process, we also identified other groups of children who we are seeing are either less prepared for kindergarten by showing having lower scores or poor attendance or suspension histories in kindergarten, or who are disconnected from our services. So we've defined both vulnerable and underserved using some of those definitions. And you called out here saying, are we looking at ACEs? We didn't look at ACEs specifically, but we did create a cumulative risk indicator with some of the data that we collected for the needs assessment to say, what are some of those characteristics of children that we can learn about at birth? They're represented on their birth records, for example. So we can think about clusters of children in different areas of the state, or maybe who are not receiving proportionate access to services. So we can think about those kiddos. And specifically from the needs assessment, we found that kiddos born to a mom without a high school education, for example, was a big group. Not a big group, but a group that was showing less access. Children born to single moms, and children with multiple risks. And we can share more about that if you had a chance to go back and look at the webinar from Friday. We have more information in there as well, and we will have those vulnerabilities further defined, but we'll be working through that as well this year as we think about that a little more. So as Kelly mentioned in the beginning, our needs assessment really was the first approach at trying to understand a lot more about our children and families, and we'll keep doing that as we move forward. So I think that we have sort of a wet cement discussion of what vulnerable populations mean, and we hope we will continue to inform that as we move forward. I hope that answered your question. Okay, now we have, let me go back. We have a comment I'm going to read from Christy Junkins. Although workforce development isn't at the heart of the early work, we can help to communicate a message. ECE is developing the future workforce! Exclamation point. Yay! Yes! That was my comment, not Christy's. The strategies will make it easier to help those not engrossed in the everyday work of ECE, but need to share a message for the good of public will, to understand and identify where they fit or where our partners might fit in as stakeholders, like businesses, WIOA program providers, and LWD boards that we work with on a daily basis. So again, another call out, well done, and thank you for all of your commitment and passion to help us find our place. So thank you, Christy, for embracing the We Are ECI theme. Let's see, Cindy asked if you could put the visual back up for the overall plan.
Yes.
I'm thinking maybe the
pyramid one. Yeah. And I think I caught, oops, I'm going the wrong direction. Okay, hang on. Let me try to get back to that. I apologize. My transitions are going really slow.
Okay.
We'll get back there. I apologize. I think I had 2 of the goal orders reversed on this visual. The third one is actually goal number 4, and then the 4th one is actually goal number 3. So I'll fix that before we post that on the website. But that's kind of the is that the correct slide? I think that's the one referenced, but yes.
we have any other pressing questions that we could help answer? Well, you've solved all the world's problems, Kelly. I guess we have no more questions.
I didn't solve them. They solved them. This has been an incredibly informative process to listen to everyone's ideas, and you know, not just our typical approach, you know, having stakeholders gathered in a room to brainstorm and talk. That's been so useful, but even just reflecting back on you know, what we heard from families through the surveys and the focus groups and from providers directly. And just to touch back one more time on that not about me, without me approach, I think our next step is to share that collaborative space even more with families and with the folks on the front lines doing the work every single day. And I'm really excited about that. Did we have any more questions come in? Yes. I think I saw a couple pop up.
I think we can answer Amy Stegeman's question as we move forward with next steps.
Okay. So I'm going to hop to the next slide then. Next step. As Chanel shared earlier, you know, this has been an intense process over the last few months, and we have been working hard and furiously, and we have a few more activities coming up before the plan is adopted. So today, again, was an opportunity to share your feedback and your thoughts and reactions. And I'm excited that there was so much excitement and energy about the plan. But on the next slide, you will see that there is a link to a SurveyMonkey survey. As you're thinking about and processing all of the information that we've covered this morning, you might have other questions or reactions. And if you see areas where we really didn't you know, address something that came out of the needs assessment, please capture that information and send it to us through that survey. As I shared, you know, we have written out a draft of the plan. It is being designed right now, but there is still time for revisions and for feedback and for comments. We have a process built, in kind of a cyclical write and review and edit process between now and the end of August. So please don't think that everything is set in stone. Your continued feedback is definitely welcome. If you could submit any of your reactions and comments by the 16th. I know that's a short time period, but it is kind of a tight time frame for us. You know, there's definitely space to add that into the plan and to rework anything that needs to be reworked. Between August 16th and August 30th, we'll be in a fast and furious final revisions editing process with the designer. I'll also share we have contracted with an external reviewer that has content expertise but can give us kind of an objective outside of the day-to-day conversation look at the plan and help us identify, you know, where we are capturing all of the feedback and where maybe there are still some gaps or things that we just need to clarify. If we want this to be accessible, if it doesn't make sense to an external reviewer, we've got some work to do still to revise that. So we'll be in that process through August 30th. We'll have a webinar for the Stakeholder Alliance to present the final plan in its designed format, and I'm thinking we'll have that available for folks to review a few days in advance of that webinar as well. And then September 6th, we take this to the ECI State Board for presentation and discussion and hopefully approval as well. After that, this plan will be something that we take as a system with our component work groups and start action planning around. There are a lot of areas where multiple component groups might need to have a say in defining how we carry out the action steps. We might need to be reaching out to additional partners to do some of that refining and planning as well. So they'll have a chance. All of the co-chairs of the component groups can take this back to their work groups and have in-depth conversations. And again, we're still thinking and planning for ways to have ongoing stakeholder feedback. We really are committed to the not about me, without me. So that means it needs to be more than just a component group process. It needs to be informed by regular participation with families. We have a lot of capacity to build even as a system in order to hear that effectively and to apply feedback from families and communities. So we'll be working on how we do that kind of throughout the process. Those are our next steps. I'll pause and see if maybe that answered the question or if there are additional questions from folks. And then I'll advance to the slide with the actual survey so folks can get that.
There's a specific question from Tara. Will you be visiting local boards to talk about the new plan once it's approved?
Hey Tara, this is Chanel. I'll be glad to answer that question. I think you mean ECI boards, but if you mean something different like childcare boards, that kind of thing, let me know. I want to share that once we get things going, definitely if it works in everybody's schedule to do that, we'll try to do that if requested. But I also want to share some other ideas. The ECI directors at their next meeting, which is not until October, but we plan on having a very deliberate conversation and review with the ECI directors to really empower them to know what's in this plan and how does it connect with their local work, with the local goals that they've set and things like that. So we want to build connections, and that's one of the strategies we will be using. Also, if it works and as it works out, we might be able to do another webinar that local boards can review and be a part of during their meeting. So for example, maybe there's a certain part of our state plan that is being reviewed at a local level, because I know a lot of boards review different sections of their planning process during different meetings. And so, if it works to build that connection during that meeting, that might be another opportunity. But definitely, if it's something that seems to make sense, we will have different folks that would be available to talk more in depth about the plan after we get it out. So that's awesome. We will do what we can.
We have another question from Ginger. Can the survey be emailed out for those thoughts that come up in the next few days? I think, Kelly, you mentioned there will be a link on the webinar.
Yes, we'll try to get it out, Ginger. Right here's the link, but we'll also put it on our website.
Sorry.
Because unless we have emails for every single person that was on the webinar today, I can't directly email it to you, even though I know yours, Ginger. But we'll try to get it out there following this presentation so everybody knows they can give us feedback. And it's a really simple, just basically you go through we list each goal, ask you if you had any thoughts. We list each strategy, do you have any thoughts? And then at the very end, there's a generic one that if you think we're missing something, that kind of thing. And so it's very easy to give feedback, and none of it's a multiple choice. It's all give us your thoughts. Oh man, loving all the comments you guys are sharing here. Let's see, Amy.
And I added the link to SurveyMonkey in the chat if you need to copy it.
Thank you. Amy, we'll work with Iowa State. It's just too big of a file, and so we'll see if we can get that, a way to get that sooner rather than later to get access to Friday's webinar. Krista, love your feedback. Let's see, the value of the first 2,000 days, I just want to, it's just a great way to start to frame discussions and thinking about the connections with young children with the rest of their lives and how they can make their best, become their best adults. I'll share, I know Bobby just had to get off of the webinar. She is the co-chair of with James Olson on public engagement. And this is one of the main things that group will be working on, helping us think this through. How do we develop more pieces and documents? We have a contract with an organization to help us build those materials once we kind of have the core of what we want, so that we can have similar themes and looks to those materials. If you want to be a part of this work, let me know and I'll make sure I connect you. We want to thank everyone again. Kelly, I don't know if you have any closing thoughts, or Heather. I just want to say thank you to everybody for re-energizing us today. We had this opportunity to share where we are in this process. So thank you so much.
Thank you, everyone. Have a great day.